We're going to talk about helping children cope with anxiety and fear tonight. And we're going to start by talking about how common fears are among children and some of the different fears that you might see with children depending on their age and their developmental level. We'll talk a bit about how to promote coping for these children. We'll also touch on how to be concerned or when to be concerned when your child may have an anxiety disorder, what are the signs and symptoms, and if you believe that your child does have an anxiety disorder, we'll talk about how you can seek help so you can get an assessment and appropriate treatment. So I want to start by saying anxiety is normal. We all have anxiety, and it's a good thing that we do, because if we weren't anxious, we'd be putting ourselves in all kinds of situations where we might encounter danger. So what anxiety does is it allows us to adapt to situations, expect that things could happen, and prepare ourselves for dealing with these situations. For example, you look both ways before you cross the street in case there's a car coming. You put your seatbelt on in case there's a car accident. You set your alarm so that you're not late for your job interview. If we had no anxiety, we wouldn't do these things. And children at different ages will be afraid of different things. So you may have noticed that when your babies were very small, say 4 months of age, you may have been able to give them to grandma and give them to your friends to hold, and then they turned 8, 9 months of age, and now they're really afraid of strangers. And so you start seeing that kind of stranger anxiety, which extends into toddlerhood. We expect that among infants and toddlers. And among preschoolers, we expect them to be afraid of the dark. Lots of preschoolers are afraid of monsters, they're afraid of new situations, but alarmingly, they're not afraid of hurting themselves. So you might notice that they're going head first down the slide, much to your horror. But then when they become school age, they're a little bit more hesitant and they're a little bit more aware that they could hurt themselves. So they're maybe a bit more cautious on the slide now, sometimes. School-age children are also afraid of animals. They can be afraid of natural disasters or things that happen in their environment. So maybe your toddler and preschooler slept through, 50 or 60 thunder and lightning storms, and now that they're 7 or 8 years old, they're afraid of thunder and lightning. So these things kind of wax and wane throughout childhood. Adolescents tend to be worried about fitting in with their peers. So they want to fit in, they don't want to stand out, they want to be accepted by their peers. And they're worried about their performance, so they want to do a good job, and they don't want to be criticized, at least not heavily. And as adults, we tend to carry this as well, so we also worry about our performance. We worry about things like public speaking. We worry about our children. Presumably, that's why some of you are here tonight. And we tend to worry about things like our finances. So if anxiety is normal, then why are we here? Well, anxiety can become a problem. So you can kind of think of anxiety as a natural kind of optimum level that helps you be prepared and helps you react to danger. But if you don't have any anxiety, you're kind of putting yourselves into these dangerous situations or in taking unnecessary risks. So, for example, some people may argue that people who participate in extreme sports, like base jumping, don't have enough anxiety when maybe they should be afraid of jumping off buildings. On the other hand, too much anxiety is also problematic. So if it's interfering with your life and it's making decisions for you, then anxiety is problematic as well. So too much is problematic, but too little is also problematic. Some examples of when a little bit of anxiety might be normative or okay, but then it crosses that threshold into too much would be being afraid of the dark. I mentioned that it's not unusual for preschoolers or young children to be afraid of the dark. And a lot of them request night lights, which is perfectly normal. But if your child wants the night light, the overhead light, the hallway light, the bathroom light, and now they're asking for a floodlight in the backyard, then you can think it's kind of getting out of hand. Again, being worried about germs. Perfectly normal. We should wash our hands after we eat, use a washroom, we should wash our hands before we eat. But if you're washing your hands 30 or 40 times a day, and you're being late for school because every time you touch something you have to wash your hands again, then that, again, is problematic. Being anxious about joining a new school or going to a new activity, you don't know who's going to be there, you're not sure what's expected of you. It can be anxiety-provoking, but not being able to go to these activities, again, that's when anxiety starts interfering with your daily activities. Being worried about class presentations, perfectly normal. But if you're a teenager skipping class every time they have a class presentation, then you want to identify that as an area that maybe it needs to be worked on. Again, if your school-age child's presenting with a stomach ache every time there's a test or a presentation at school, then again you can see how it might start interfering with school performance. So you want your children to have a little bit of anxiety so that they're motivated to do well, but you don't want them to have so much anxiety that it's interfering with their lives and their daily routines, or they seem to be under a lot of distress all the time. So what we know about anxiety is that there's 3 components. Every situation gives rise to a thought. Sometimes these thoughts are pretty automatic and we don't really pay attention to them, but they're always there. So any situation that gives rise to a thought then affects how you feel. So how you feel then interacts with how you think. And how you think and feel about a situation influences what you do. So it influences your actions. So if you're standing in the middle of the street, perhaps playing catch with your child, and you hear the tires of a car squeal, and you think, oh my gosh, there's a car coming, I could get hit by a car, and you start to feel your heart racing, your breathing gets a bit shallow, and you jump out of the way. So you think, oh my gosh, a car, I could get hit, you feel anxiety, and the action is you move. If you're standing in the middle of the road and you hear those tires squeal, same situation, but you think, they'll stop, then you don't really feel any anxiety and you feel kind of calm and you don't move out of the way. So same situation can give rise to many different thoughts, but which one we think about influences how we feel, and that'll impact how we act. And I'll come back to this again. So some behaviors that you might see among your children, some of these actions that you might see, is you might see crying or clinging, you might see fear that's too strong for the situation. So you might think, okay, I understand how joining a new basketball team is a bit anxiety-provoking, but my child's having a full temper tantrum, he's crying, he's clinging to the car door, so you might see behavior that doesn't really fit with the situation, or you think is too extreme for the situation. Your child might avoid going to activities altogether, or avoid going to school. They might freeze up when you introduce them to new people or when you bring them in new places. You might get a lot of clinging and crying and whining, certainly among young children. Maybe when they're in these situations, they'll be tugging on your arm saying, can we go now? Can we go now? I don't want to be here. Please, can we go? You might see your child has difficulty sleeping. If they're laying in bed thinking about everything bad that happened today and everything bad that could happen tomorrow, then that will interfere with their sleep. You might also see that they're having nightmares, and that's impacting their sleep. You might find that your children are a bit perfectionistic, so maybe the homework assignment they should have taken 10 minutes is taking an hour because they're copying it over and over and over again because according to them it's just not quite neat enough. So you might also see physical complaints, and these are very common for children to complain about stomach aches and headaches. And I just want to remind you that just as adults tend to get headaches when they're under a lot of stress, the headache is real, right? The pain is real, but it's caused by stress. The same holds true in children. So your children may have stomach aches and headaches in order to get, and you think they're doing it to get out of activities, which to some extent might be true, but usually the stomach aches and headaches are real. It's just caused by stress as opposed to be caused by something like the flu. But how you act, whether it's the flu or whether it's avoidance, are different. So we'll talk about that more. So some things you might hear is that thought part of that triangle I showed you. So your children, if they're anxious, tend to overestimate how bad something is going to be and the likelihood that it's going to happen. So something bad is definitely going to happen, and it's definitely going to be catastrophic. It's going to be the worst thing ever. So your child might be seeking reassurance from you because of that. So, well, what if this happens? But how do you know it won't happen? Are you sure? And you might find that you keep reassuring them, but they never stop asking the questions. And that's because we know that frequent reassurance of children doesn't actually help them with their anxiety. They'll just keep asking you over and over again. You might have a child who has repetitive thoughts and actions, so you might hear them saying the same thing to themselves over and over again, or they might have the same little ritual. So maybe they have to count to 5 before they touch the doorknob. And if you try to hurry them up, then they want to, reset, take a step back, count 5 again before I touch the doorknob. Or you might see repetitive actions, such as washing their hands over and over again, or checking on something over and over again, or getting you to check it. So they're laying in bed saying, "Mom, are you sure the door's locked? Can you check again? Maybe the door's not locked." And you have to check the door 15 times before they go to sleep. You might have a child that's afraid of making mistakes. You might see signs of low self-esteem. You might have a child who's afraid of being home by themselves. So maybe they're in the middle of their favorite movie, and you get up to go to the washroom. They're like, "Where are you going?" And they follow you around the house. And they just kind of on your coattails everywhere you go. Or your teen that's refusing to stay home alone and is following you around out into the community. You might have children who are also articulating worries about you. So they might be worried about your health or their health. So they'd be, "Mom, are you sure you don't have cancer? How do you know? Can you go to the doctor?" So you might hear those kinds of excessive questioning that way. So anxiety then becomes a disorder when it interferes with your life. So although lots of children have a little bit of anxiety or worry, and we talked about this being a good thing, when it's interfering with daily activities and daily functioning, then it becomes a disorder. Or when it's causing you significant distress. So maybe your children do make it to school, but they're, this panic-stricken face all day in the classroom, hoping that the teacher doesn't ask them a question. It's also a disorder if it's too extreme for the situation, or it's triggered all the time when there's not actually a threat. So your children seem to be having lots of anxiety when there's no real threats in the environment, but they perceive that there is one. No two children who worry do it the same way, but there are different patterns of anxiety that kind of lend themselves to certain disorders. Children with separation anxiety have difficulty separating from caregivers, and they're usually concerned that something bad will happen to them or happen to you. An example of this would be a 12-year-old girl who becomes distressed when her parents are going out for dinner, or when she has to go to school. She avoids going to sleepovers. When she does go somewhere without her parents, maybe she calls her cell phone repeatedly to make sure that they're okay, or to ask to come home. A social phobia refers to children or adolescents who are fearful of certain situations. So they're fearful of their performance, so they really worry about embarrassing themselves in a situation. An example of this might be a child, let's say an 11-year-old boy who's in a classroom, and he doesn't ask any questions, he refuses to do class presentations, and on the playground he kind of hangs out on the perimeter and doesn't interact with the other kids. Generalized anxiety disorder are people who generally worry about many aspects of life. So they might worry about their health and your health and school and work. So for an example, you might have, again, let's say a 12-year-old boy who's asking you, "What if?" all the time, but what if this happens? But what if that happens? But how do you know it won't? And they might worry about their schoolwork. If they don't get a B on the test, then they don't think they'll get into university, or usually it's an A, they all want A's. And they maybe worry about world affairs and lots of different things. A simple phobia refers to a fear of something, an object or a situation. So an example might be a fear of dogs. So while lots of kids might be afraid of dogs, again, this is where it interferes with your life. So your kid refuses to go to the park because they saw a dog there once. Or if they see a dog on the street, then they cross the street. Or they won't go to grandma's house because grandma got a little dog. So they avoid what they're afraid of. And then that impacts on how you get through your daily routines. Another example might be a child who has a blood phobia. So lots of kids don't like blood, but a child that has a blood phobia maybe won't let you cut vegetables in front of them, because what if you cut your finger and they see blood? Or they won't, engage in physical play, because what if they scrape their knee and then they see blood, and they don't want to go to the dentist and they don't want to go to the doctors, because those are places that they might encounter blood. Children with obsessive-compulsive disorder, as I alluded to earlier, have repetitive intrusive thoughts and or behaviors. So you can have one or the other or both. So these are kids, the classic example is classic hand washing, or children who engage in the kind of checking behavior compulsively. And sometimes kids will report having kind of these negative thoughts that kind of pop into their head all the time, that they'll do something horrible and they think that makes them a bad person. And they'll perform some action to kind of neutralize that thought or make it not really come true. Children with panic disorder will misinterpret bodily sensations, and they have a fear of losing control. So if their heart's racing, they'll think they'll have a heart attack. And those with post-traumatic stress disorder or adjustment disorder have anxiety that's related to stressful life events. So a post-traumatic stress disorder example will be a child that was involved in a car accident and is now having nightmares about the car accident, and won't go in the car, won't go near the scene of the car accident, and is avoiding everything related to that event. And those with adjustment disorder are having anxiety or difficulty adjusting to a negative life event, such as a parent who has an illness. So anxiety disorders are the most common psychological problem found in children and adolescents. And as many as 1 in 10 children or youth actually meets criteria for an anxiety disorder, with the disorder that they have varying by their age. So despite the fact that anxiety disorders are this common, we're more likely to see a child with behavioral difficulties come into our office than a child with anxiety. We believe that the reason for this is because children with behavioral disorders call attention to themselves. They disrupt classrooms, they disrupt home routines, whereas children with anxiety may not draw as much attention to themselves. With that being said, you can have behavioral difficulties when you have anxiety. The two are not mutually exclusive. But as a general rule of thumb, we tend to only see about 1/3 of children with anxiety disorders. So that means there's 2/3 of children out there who never actually get treatment. So how does anxiety come about? Well, genetics are a big one, of course, biological predisposition. But the research indicates that what's transferred from generation to generation isn't necessarily a particular anxiety disorder, but more kind of an anxious temperament. So if there's a child in our office who's presenting with a phobia of some sort, we don't necessarily expect that the parents will have that phobia. Parents might not even have an anxiety disorder, but in general, at least one parent tends to be a bit more cautious or be a bit more anxious in general. And so it seems to be more like a personality trait that's transferred and not necessarily the specific disorder. With that being said, we know that modeling and our reactions to our children are very important in curbing how they deal with their anxiety. So for instance, when your children were very young, learning how to walk, 12, 13 months of age, and they're waddling around in their diapers and they fall, the first thing they do is they look at you, right? They look at you to see, what should I do? And if you jump up out of your seat and you say, oh my gosh, and you run to grab them, then they cry. But if you say, oops, you fell on your bum, then they kind of just laugh and they keep on going. Right? So children will look to you to determine how to react in a situation. Same thing if they don't have a lot of experience with dogs and they're at the park and a dog comes over to them. They're going to look at you to see how they react. Young children presenting with separation anxiety do the same thing. They look at their parent to see how they should react to that stranger. So we know that modeling is very important. We also know that stressful life events, as I talked about earlier, can also come before anxiety or be the onset for an anxiety difficulty. Some protective factors include being encouraging and being optimistic. So instead of sending the message to your children that what can go wrong will go wrong, sending them the message that expecting good things to happen and having a more optimistic outlook on life. Friends and social supports are also good protective factors. And being in an environment that nurtures participation rather than the emphasis on achievement is important, especially for children who tend to be perfectionistic. So you want to model that, just playing the game is what's really important, and not that you actually win the game or that you do the game perfectly. We know that when anxiety is not treated, it can interfere with school. So if your child is sitting in the classroom worrying about whether or not the teacher is going to call on them, and worrying about the tests they have next week, and worrying about whether or not their friends are going to play with them at recess time, then they're not listening. So sometimes children are referred for attentional difficulties, and we find out after our assessments that it's because of anxiety. So you can imagine if you're sitting in class worrying all day, you can tend to get a bit behind in your schoolwork. Anxiety can also interfere with social relationships. If you're socially anxious and you're hanging out on the sidelines and you're not really interacting with your peers because you're worried about embarrassing yourself, or you're worried that they're not going to be nice to you, then that can impact on your social relationships over the long run. Anxiety can also impact your choices of careers. So a teenager who is worried about talking to other people and thinks that they'll mess it up, they're not really going to apply for jobs without a lot of encouragement, or so they don't get the part-time job at McDonald's or whatnot because they're too afraid to apply. Again, maybe your children want to be doctors or teachers, but they're worried about talking to other people, so they tend to cross those off the list because they don't think they'll be able to do it. And so this impacts your self-esteem and your self-confidence if you're continuously avoiding things because you believe that you can't do it because you're afraid of it. Adolescents and adults with anxiety are at increased risk for substance abuse. So if somebody is having a hard time talking to people, maybe they'll have a couple of drinks and try to relax a bit. Problem is, this backfires because the next day you're worried about everything you said and everything you did and what everybody thought about you. It also, over the long run, using alcohol to kind of get through these situations creates dependence, can lead to alcoholism, and all kinds of the social or the physical effects that go with that, and the health risks. We also see adolescents and adults use marijuana to try to cope with anxiety. Sometimes this has a paradoxical effect, and it doesn't actually relax them and actually makes them paranoid, makes them focus on their symptoms more, makes them focus on bodily sensations more, and so then they end up in ER with panic attacks, and we've certainly seen that here. So if untreated, though, anxiety will extend into adulthood, and usually does, and we often see it as comorbid with depression then. So how do we help children, teens, and adults with anxiety? Well, behavioral or cognitive behavioral therapy is a treatment of choice, and that's the one that's most supported by the research. So the triangle I showed you earlier with the situation leading to thoughts and feelings that then influence actions, that's what this is meant to target. So the cognitive part refers to thinking, and it refers to challenging those thoughts that something bad's definitely going to happen, it's going to be catastrophic. So not making all the thoughts positive, because you can't really think everything's positive all the time, but making it more balanced and realistic. The likelihood that everything is going to go wrong is quite small. So maybe thinking about it more realistically is something that we think is helpful. And then when you have these kinds of coping strategies, like self-talk, like, oh, it's probably not going to be so bad, and I tried really hard and I really studied for that test, and all I can do is my best, and last time I had a test I did okay. So having those kinds of thoughts then prepares you to go into the situation that you're afraid of. So that's the behavioral part. But if a child is afraid of the water, we don't take them to the Y and drop them in the pool. We have to take baby steps to get there. So if your child hasn't been to school in 6 months, maybe they go to school for one class, or maybe they only go to school at recess time until they're comfortable, and you kind of build up from there. So although going to school full time is the end goal, you want to take smaller steps to get there. There are certain medications that are also recommended for anxiety, and usually in children we usually recommend that cognitive behavioral therapy or behavioral therapy is tried first. And children who have very significant difficulties with anxiety, a pediatrician or a psychiatrist might choose to use medications in conjunction with therapy. So parents and educators can help children cope with their anxiety by finding their children's areas of strength and using those. So instead of pointing out, everything that they're avoiding and everything that's going wrong, pointing out all their strengths and all the things they do well. And you can use their strengths to help them cope with their anxiety. So if your child is avoiding hockey and basketball and all the things that you want to enroll them in, but they like to draw, then maybe you can ease them into an art class. You want to assign appropriate chores and expectations to help build self-confidence and communicate to your children that they're capable of doing these things, and gives you an opportunity to reward them for doing these things. You also want to acknowledge coping behavior. So if you catch your child taking a deep breath, or you catch them using these kinds of coping thoughts, you really want to pay attention to that and reinforce that. Children also have trouble making the link between the kind of bodily sensations and how they're thinking and feeling. So helping them establish that link by saying you have a stomach ache because you're worried about going to school. Your heart's racing because you're worried. So pointing out that link over time can help them establish that. You want to normalize anxiety, let them know that all children have worries and all adults have worries. And you can model how to cope with worries. If you have a job interview, you can say to your child, like, I'm really worried about my job interview, and what if I don't do a good job? And, I have kind of some of these silly thoughts about, I wonder if they'll laugh at me. And so you can point out and have your kids help you generate some of the coping thoughts. Well, last time I had a job interview, I did a good job. It's not likely that they'll laugh at me. They're nice people. What's the worst thing that could happen? I could not get the job, but the interview would still be good practice, and I still have the job I have now, and I like that one. So you can help your children by modeling those kinds of coping thoughts. You can also teach relaxation strategies, like deep breathing. So deep breathing is like belly breathing. So a good kind of rule of thumb is you can put one hand on your chest and one hand on your stomach, and the goal is for the hand on your stomach to rise more than the hand on your chest. So you want to take deep breaths and then let them out slowly. With kids, sometimes it helps to visualize different strategies. So you can talk about blowing up a big balloon, taking in all the air, and then letting it out really slowly. Or you can talk about blowing bubbles, and you're going to blow all your worries away. Using things like visual imagery is also helpful, so coming up with a special place. So if your children have trouble sleeping because they're worrying about everything bad that's going to happen tomorrow, then maybe around the dinner table you can come up with a special place for them. So maybe they really like the beach, and you can help them visualize laying on the beach in the sand, and they can feel the sand between their toes and feel the sun on their face, and they can hear the waves crashing on the shore. And I'll stop now so that you remain awake. But the more details you incorporate, the easier it is to visualize, and then your children can fall asleep thinking about that as opposed to thinking about all the horrible things that could happen tomorrow. Another good one is progressive muscle relaxation. So that's tensing different muscle groups and then letting it go. Again, incorporating visualization makes it easier for little kids. So you can say something like, pretend you have 2 oranges in your hand. You're going to squeeze all the juice out, squeeze hard, 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 and now let it go. Or you're going to talk about making parts of your body really strong, make them super strong, squeeze, squeeze, squeeze. Now make it loose like spaghetti. So again, the deep breathing, the progressive muscle relaxation, and special place are very good kind of coping strategies, ways to relax, and the coping self-talk. It's just my worry. I'm not really having a heart attack. I can do this. I've done it before. I did a good job. And for really young children, just like, I think I can, I think I can, I think I can. And that can really help them kind of get through the situation that they're worried about. You can also help them cope by rewarding non-anxious behavior. So trying to catch them doing something that they normally wouldn't. So catch them being brave. So if your teen is having trouble talking to people and you see them pick up the phone and they dial it and then they kind of hang up before it rings, you can say, good try. That's a good try. Maybe you can try again later. But you want to reinforce them for trying. If your child is afraid of the dark and they go down to the basement to get a popsicle out of the freezer, that's pretty motivating. They want the popsicle, but you still want to reinforce them, like, good job going downstairs, and I know it's really hard because it's kind of dark down there. Good job. So you want to make a big deal about these times, and you want to be very specific in your praise. So you want to let them know what it is that you're praising, and this will help build self-confidence and help them feel better about themselves over time. And the hardest thing I think we tell parents to do is ignore behavior that they don't want to see. And the best advice I can kind of give you about this one is that if you decide to ignore it, you got to stick to it, because your child will up the ante. That's what we all do, right? When somebody's ignoring us, we say it louder, or we say it a different way, but we tend to be persistent, and our children can be very persistent. So what you want to do is, if you're ignoring something, don't give in 5 minutes later, because then what you do is you teach your children that if they're persistent enough, mommy will pay attention. So you can remove your attention, though, from things like the stomach aches, the repetitive stomach aches, the reassurance seeking, the question asking, and the temper tantrums, as long as everybody's safe. But you want to tell them that you're ignoring their behavior and not them. So if your child's in the back seat of your car saying, Mom, can you slow down? Can you please slow down? What if we get in a car accident? How do you know we won't get in a car accident? And you're going 20 kilometers an hour down Roby? You can say, that's your worry talking. I'm ignoring your worry. Let me know when you want to talk about something else. The key is to reinforce them as soon as they change the subject or as soon as they ask something else. So even if your child is crying because they're anxious and they go, reinforce them for taking that breath. Say, good job calming down. They might start crying again, but you want to reinforce their attempts to calm down and send the message that that's the behavior you want to see. You want to prevent avoidance as much as you can, but at the same time, you can't really push a child or a teen to do something that they're terrified of. So if your child is scared to take the bus, then taking the bus to school and home every day might be too hard for them. And you want to set them up for success. So you can tell them, we're going to work on taking the bus to school. I know this is really hard, so let's work towards a reward. Maybe you take the bus to school one day this week, and then on the weekend, you get to pick the movie out that we watch. So again, you want to reward your children, but you don't need to buy them a new Xbox to do these things. You can just work out something, a very small reward, and it can be timed together. So maybe they take the bus to school one morning a week, and then you increase it to 2, 3, 4, 5, etc. If you're kind of a prisoner in your own home and you haven't been out for dinner in months because your child refuses to stay with a babysitter, then you can tell your children that you're going to work towards staying with a babysitter, and that you think that if you take some small steps to get there, then they can be brave and do it, and you'll work towards rewards. So there needs to be an incentive. No child in their right mind is going to commit to do something that terrifies them unless there's some kind of motivation and incentive. So maybe the babysitter comes over and stays for 10 minutes while you sit on the front step. And when your child's comfortable with that, and you've told them, good job for, I know that must have been really hard, you did a really good job, and, here's a sticker. They get 5 stickers, and then they get to pick their favorite meal. And then after 10 minutes of you sitting on the front step, maybe the next time you walk around the block. When they're comfortable with that, maybe you go to the grocery store for half an hour, and you increase it from there. And before you know it, you're out for the night having dinner and drinks with your friends. So again, with bedtime, you want to be cautious of that as well, and try to ease your kids into sleeping in their own room again if they're not currently doing that, or encouraging them to turn the lights out. So if they have 4 lights on, turning 1 out at a time, and you're not doing this behind their back, you've made it a goal that you're working on together. You can also role play, so if your kids are having trouble doing class presentations, maybe they practice with you, and then maybe you practice it with them and their grandparents and maybe a couple of friends, and you kind of increase it gradually till they're more comfortable presenting at school. And just like anything, just like when your children were learning how to read or learning how to ride a bike, all these strategies take practice. So there's a lot of different strategies, but these are some nice acronyms to help you remember them. Fear is feeling frightened, expecting bad things to happen, attitudes and actions that can help, and results and rewards. So if you could just kind of take that home, it's a nice little way to remember these different strategies. And friends is feeling worried, relax. Inner thoughts, which is kind of those coping thoughts we talked about, identifying those negative thoughts and working on more realistic ones. E is for explore, plan, N is nice work. That's the praise and reward that I talked about. And D is don't forget to practice, very important. And S means stay calm. Strategies we want to avoid are excessive reassurance. Again, we know that reassuring your children and answering those questions repeatedly don't actually help. It just reinforces the anxiety, and they keep asking over and over again. So you want to try to limit your excessive reassurance. Again, we do it because we don't want to see our kids in distress. We don't want to see them stressed out. But if it worked, they would have stopped asking. So just to be kind of cautious of that. Unrealistic expectations, again, I talked about that. So kind of setting up smaller steps to get towards what you're afraid of. You want to try not to be too overprotective. Again, we do this because we don't want to see our kids under a lot of stress, but you want to realize that by not having expectations of them and letting them try things, we kind of undermine their ability to do it and create more dependence on adults. You want to set appropriate limits like you would with all children, and you want to be careful not to be too directive. And when you come up with strategies, children are more likely to implement them if you work on them together and they're a part of creating these strategies. So, and then they are more likely to come up with strategies in the moment as well. You want to try not to permit avoidance. So it's hard to nag our children all the time to do the things that they're afraid of, but you want to work on having them actually follow through with what's expected. And you want to make sure that you're not allowing them to avoid it all the time, because if they keep avoiding it, they'll never learn that there's not a real threat and that what they're imagining might happen isn't really true. And you want to monitor your own frustration, because the excessive questioning is difficult, or your children continually avoiding things can be very difficult. So just kind of monitor when you are getting upset, because if you say things like, well, you could do it if you tried harder, or stop asking me those ridiculous questions, what we kind of see happens is parents then feel guilty, and they're more likely to let their kids out of it because they feel bad that they said that. So just to kind of monitor when you're getting frustrated, so that you can take some time out as well. Diet, exercise, and sleep are very important. They're very important for physical health and mental health. Diet, you want to make sure you have healthy meals, plan healthy snacks, especially for busy times. Something like 1/3 of Nova Scotian youth now meet criteria for obesity. That's an alarming number. And those children have higher risks of heart disease, diabetes, all kinds of physical problems, and they tend to have more anxiety as well, because they're worried about how they look and what they'll do, and they don't participate in things as much. So you want to be cautious of that. Caffeine is another important one. Caffeine makes us more hyper-aroused. That's why as adults we drink it, but it creates more anxiety. And we've known this for a long time in adults, and now we see our children drinking a lot of caffeine. So you want to stay away from the dark colas and the hot chocolate and ice caps. Kids love ice caps. They have a lot of caffeine in them. If your children do drink things like pop, then you want to limit that, after 2 or 3 o'clock in the afternoon, or else it'll interfere with sleep. And things like hot chocolate or s'mores or things like that before bed aren't a good idea either, because, again, the caffeine in the chocolate will interfere with your child's sleep. Exercise is very important. When we exercise, our body releases endorphins. That endorphins calms us, it helps us sleep better, and it's good at regulating our own bodies. You don't have to take your children to the gym with you, but you do have to remember that modeling is important. So maybe you encourage your children to come for a walk with you after dinner. Or it's getting nice out now, you could play catch. You could plan as a family to participate in something like the 5K Blue Nose. You don't have to run, you can walk. And you don't have to do all of it, you can just do part of it too. But the goal would be to participate in activities, then encourage your children to participate. Some parents have told me they've started kind of volunteering for summer camps or different activities in the summer, or after-school activities, as a way to try to encourage their children to participate as well and be more physically active. You want to actually have a good sleep routine as well, so kind of same routine every night. Should be a reasonable bedtime, and you should try to keep that bedtime on the weekends as well in a similar routine. What happens is we kind of lose our routines over the weekend, and then Monday morning comes and it's really hard to get back into our routines again. So again, if your children sleep well, they'll do better. They'll tend to react less with anxiety, and so you want to make sure that they get a good night's sleep. So in summary, anxiety is normal. Everyone has anxiety, and it's a good thing that we do. You can help children cope by modeling appropriate responses to anxiety and appropriate ways to deal with anxiety. Label their anxious behavior so they have a good understanding of what it actually is. Encourage the use of those coping strategies we talked about. You want to reward brave behavior and encourage children to gradually fight their fear by facing it. And remember that it's not helpful to provide lots of reassurance and to permit them to continue to avoid everything they're afraid of. And there's books. These are great books for parents. Keys to Parenting Your Anxious Child is a really great book. It's not very long, and it's maybe, I think it's between $12 and $15, and it's available through Chapters and Amazon. Katharina Manassis is a psychiatrist from the Hospital for Sick Children and the head of the Mood and Anxiety Disorders team there, and she wrote this great book for parents, and it has a lot of suggestions for how to respond to the excessive questioning and how to gradually expose your children to things they're anxious of. Helping Your Anxious Child, a Step-by-Step Guide for Parents by Sue Spence and colleagues is a group from Australia who actually designed the treatment program that we use at the IWK for children who have anxiety. And this book goes into a lot more detail about how to set up those steps towards, the baby steps towards facing your fear. And we generally recommend this book for children who do meet criteria for anxiety disorders or who have quite anxious temperaments. Talking Back to OCD, the program that helps kids and teens say no way and parents say way to go, was written by John March, who's one of the world's leading experts in obsessive-compulsive disorder. And this is a very it's well laid out book. It's great for parents if they have a teen or a child that has this disorder. And Helping Children with Selective Mutism is a book that was actually, one of the authors is Melanie Vanier, who introduced me tonight. And we didn't talk about selective mutism tonight, but there'll be a talk about it in the fall. And this is for kids who can talk, but don't talk in some social situations. So they talk at home, but they don't talk at school, would be a classic example. And this is a great book for strategies about how to gradually encourage children to talk in those social situations. Another one would be Nurturing the Shy Child. Again, all these books are available through Amazon or through Chapters, and you can Google them to find them. Here's some internet resources that are good. The internet is a great tool, has a wealth of information, but you want to be aware that sometimes there's a lot of information on the internet that doesn't have information that's based in research, but these sites tend to publish or post information that we know is accurate. And these are some books for children, and they tend to be geared for younger children, so Don't Pop Your Cork on Mondays, A Boy and a Bear, When I Feel Scared, Wimberly Worried, or What to Do When You Worry Too Much. And Understanding Katie is one that's particularly for children with selective mutism. So these are all books, again, geared for younger elementary school children. There's also a set of workbooks called Taming Worry Dragons, and those are available through the University of British Columbia, and the authors are Garland and Clark. And these workbooks are great to be able to work through different anxieties with your children. And they tend to be geared for younger children again, so we would use them with children, say, between 4 and 8 or 9 years of age, depending on their developmental level. And if you believe that your child has an anxiety disorder or is having significant difficulties coping with anxiety, please contact your local mental health clinic. You can usually get this information from the Yellow Pages, or you can Google it, or you can ask your family doctor and they'll refer you to the appropriate resources. In Halifax, call IWK Centre Referral at 464-4110. So again, it's 464-4110. And somebody that's very nice will answer the phone and ask you lots of questions about how to appropriately direct your child to services. For further information about accessing other public or private therapists in the community, you can find a list of them at apns.ca.